Philippines has imposed a travel ban on Nepal, Sri Lanka, Bangladesh, and Pakistan as neighboring country India deals with a catastrophic wave of COVID-19 infections. The health department says there is still no detected COVID-19 case involving the new variant from India, but samples from 6 people who recently came from the South Asian country are now being tested. At this point, we'd like to talk to OCTA Research fellow Guido David. Good morning, Professor David. Thank you for joining us.
Yes, hi. Good morning, Ria.
Now, Professor, if ever na magkaroon ng Indian variant dito sa Pilipinas, how will this impact our healthcare system? How potentially devastating could this be?
Well, this is potentially devastating because if we let it spread in the national capital region and the surrounding areas, we will see another surge, just like what we have seen over the past more than 1 month. And we're happy to report that we are recovering nicely in the NCR. Cases are going down. The reproduction number has decreased to 0.74 in NCR. But at this point, the case level is still significant, and hospitals are still basically have high occupancy. So we cannot really afford another surge at this point in time.
So as you mentioned, we are seeing this slight drop in the number of cases in the past couple of days. But how accurate a picture are these numbers, given that almost on a daily basis, there's a certain number of labs who don't submit their reports for that day?
Well, that's true, Ria. We are aware that there are several laboratories that are usually late in submitting the reports, but we do have other indicators that we look at. Aside from just the daily cases, and the decrease is actually significant enough that we can call it a downward trend. So even taking into account the late reports from laboratories, which we can extrapolate in a way in our models, we're pretty confident about the downward trend. That being said, the trend is still relatively unstable, meaning that there are still some LGUs which have not seen over the past few weeks a significant downward trend.
Right, that is definitely good news. Now, you have indoor dining allowed again in a limited capacity, as well as personal care services. They're also allowed. How do you see this ease in restrictions affecting the numbers?
Well, so far, it's almost a full week of the MECQ Flexi. We still haven't really seen the effects of these easing of restrictions. We'll probably know more about this by the end of this week. I mean, it's almost the end of this week, but we'll probably know more by around Sunday or even by Monday if there will be any changes in the trend that we're seeing right now. But so far, we're not detecting any trend yet. So if we don't detect any trend, it would be safe to say that this has not led to any spike or increase in cases. That being said, we're monitoring the situation very closely. We mentioned that anytime we are indoors and we remove our face mask, there is a risk of transmission. And what we would recommend, of course, is for these indoor dining establishments to re-examine or upgrade their ventilation system, or sometimes maybe it's better to have open windows in certain situations. But if they are able to circulate the air fairly quickly, it would lessen the risk of transmission indoors, especially for dining areas.
That's right. Now, economic managers, business owners, they're all eager to open up the economy even more. How low do cases have to be before you would start recommending a further easing of restrictions? Are you looking at the daily cases? Are you looking at the reproduction number or the number of active cases?
Well, Rhea, based on some studies we made, right now the hospital utilization will remain high until we get the number of cases in the NCR down to about 2,000 per day. I mean, actually, the cutoff is around 2,500, but we want a margin of error. So maybe down to about 2,000 cases per day in the NCR on average. If we can get that we would feel a lot better about easing restrictions because even if we have a spike, it will not yet overwhelm the healthcare system. I mean, of course, we don't want a spike to happen. We always recommend easing restrictions in a gradual manner. We support, restoring the economy and accelerating the recovery process. We believe we should do so gradually, but we will know more again once we see the numbers in the for the MECQ Flexi, so we can have a better assessment of how fast cases are decreasing. So we're also going to be looking at the reproduction number, but mainly just the number of cases. If it goes down to about 2,000, we'd feel a lot better about it.
All right, thank you for that. We always appreciate your expertise here. That was OCTA Research Fellow Guido David.